Welcome everyone, and thank you for attending this Lunch and Learn session organised in collaboration between the Knowledge and Library Services at NCIC and Boost, the North East and North Cumbria Learning and Improvement Community. My name is Ashley Eaton and I'm from Boost, and today we are joined by Tracey Garbarino, who is a health literacy trainer, and she's going to be talking to us today about health literacy awareness. Able to hit the next slide for me, Tracey. Thank you. So these Lunch and Learns are designed to be a relaxed and informal space for health and social care staff to come together, share experiences and share that learning. Next slide, please, Tracey. So before we kick off, just some very quick protocols. Webcams off, please, during the session. If you can mute yourself when you're not speaking, post any questions in the chat, and we'll also have some time for questions at the end as well. Listen with respect and be present. Please pass on, share the learning, share the word about these sessions, and please be aware that we are recording today's session. We will post a link to be able to give feedback in the chat, so if you're able to complete that, that would be much appreciated. It's very short, just a few questions. And I will now hand over to Tracey. Over to you.
Thanks very much, Ashley, and hello to everyone. As Ashley said, my name's Tracey Garbarino, and I'm one of the health literacy trainers for the health literacy regional team working across the North East and North Cumbria. So today I'm going to introduce you to what exactly health literacy is and how it can make a difference to health inequalities. Currently, the way that healthcare organisations give information can make it harder for some people to access and, of course, understand their care. And this, of course, is unfair, and it is something that we can change. So in the North East and North Cumbria, healthcare services are working together to make health and social care better and fairer for everyone. And one way we're doing this is by improving health literacy. And so today, in this short session, it's a brief overview. So I'll tell you what health literacy is, why it's a problem, what we can do about it. So firstly, health literacy, what is it? It's about people being able to understand their health so that they can make decisions about it. It's about them being able to get hold of the information in the first place, of course, and having the skills to understand exactly what it means. It's about being able to check if the information is right and good quality, and then using it to make some kind of decision about their health or care, or indeed that of the people that they care for. And there are lots of things organisations can do to make it easier for people. We can make information easy to find and get hold of in the first place, and we can make sure that it's easy to understand and, of course, that it's reliable. So there's been lots of studies around health literacy, and Professor Don Nutbeam did a study and created a model around the personal skills that are required to fully understand health information. And he broke that down into these three levels: functional, interactive, and critical. And the functional level is being able to read and understand health information, including simple calculations. So, for example, being able to give the correct dosage of tablets. On an interactive level, it's about being able to interact with health information for personal use. So, for example, looking at websites for recipes and changing ingredients according to your diet or your preferences. Or looking at healthy diet advice and applying that to your own circumstances when you're doing your food shopping, for example. And on a critical level, the highest level, it's about appraising the reliability of any new information that you come across. So, for example, is it current? Is it in date? Who wrote the information? What's the purpose of the information that you're reading? And of course, is it trustworthy? And all of these skills, these personal skills, feed into the World Health Organization definition of health literacy, which is being able to access, understand, check, and use information to make choices about health. And The understand is the functional level that Nutbeam's model refers to. Access being the interactive level and check-in and using being the critical level. And these are the skills of individuals, but the World Health Organization in 2021 updated their definition of health literacy. And health literacy refers, as we've said, broadly to the ability of individuals to gain access, understand and use information in ways to promote and maintain good health for themselves, but not just for themselves, for their families, and it has a knock-on effect with communities. And while there are lots of different definitions used to define health literacy, it is a rather evolving concept. But there is an agreement generally that health literacy means more than being able to, say, read pamphlets or make appointments or understand food levels or labels, sorry, or comply with prescribed actions from a doctor. It's not just a personal resource, and the World Health Organization update includes the higher levels of health literacy within populations because it has social benefits too. For example, mobilizing communities to address the social, economic, and environmental determinants of health. And this understanding in part fuels the growing calls to ensure that health literacy isn't just framed as the sole responsibility of individuals, but equal attention should be given to health organisations and asking them to present clear, accurate, appropriate, and of course, accessible information for diverse audiences. And so when we think about how health information usually gets shared, it's useful to think about these different channels. There are conversations that happen with health professionals, of course. Information from, let's say, a GP might come in a written format, for example, a leaflet or an appointment letter. There is, of course, the digital element, increasingly so nowadays. And we might get test results via a text message, or people might be encouraged to use the NHS app to make appointments or through an e-consult. And of course, there's the environment. How do people actually make their way to the appointment in the first place? Or how do they find the department within a hospital, let's say, where they're going to have a scan, perhaps? So when we think about the health literacy skills of individuals, who are these people who struggle with these skills or who are affected by low health literacy? Professor Jill Rowlands, who is a practicing GP in the Northeast and an academic at Newcastle University, did a study in 2015, and it's entitled A Mismatch Between Population Health Literacy and the Complexity of Health Information. And her study revealed or identified people in these categories who are likely to suffer from low health literacy skills. And so it might be those people on those categories on your screen that live in a deprived area, over 45 and ethnic minorities or people with English as a second language or have been born outside of the UK. The lower qualification means people who are at the not at the expected level that they reach when they should reach when they leave school at 16. It might also include people who are unemployed or earn less than £10,000 a year, on a low job grade, not a homeowner, have mental health problems or a learning disability. So when you think about the people who fall into those categories and think about the people who you perhaps come into contact with who fall into those categories, if you could just pop a little guess in the chat, what percentage of people in our region do you think is included in those categories? Or what percentage of people do you think might suffer from low health literacy skills? Have a guess. Just pop a number into the chat and we'll see where we go. We've got 45%, 35%, 60%. 25 and another 60, 55, quite varied. So from around 25 to around 60%. Well, the big reveal, the average age, the average in our region is 67%. So that's 67% of adults across the Northeast and North Cumbria have low health literacy skills, which means they struggle to understand health information that contains words and numbers. And just to put that into a comparison, the England average is around 60%. So that kind of highlights why it's really important that we do this work around here. And that equates to the average adult has a reading age in England, that is, between 9 and 11 years old. And I think you'll probably agree that that statistic, that 67%, is quite startling, really. However, it is a little bit of a trick question because everyone can be affected by their health literacy levels at some point in their lives. Think about how you feel when you're in shock or when you receive some shocking news or when you're stressed or extremely tired or how you feel when you're ill, of course, as well. You don't always process information in the same way that you might do on a normal everyday basis. And so that 67% in our region, of course, will inevitably include lots of people within your workforce. So it's not just the general public or it's not just those patients that you see every day. It kind of includes everyone, really. And so thinking about health literacy and that statistic as well, why is it a problem for patients and the public? Well, adults who have low health literacy and their children and families do indeed suffer the worst health outcomes in society. And just to expand on that a little bit, people with low health literacy skills are more likely to die younger of preventable diseases. They will have more difficulty managing medication. It's more common that they have long-term conditions, and those long-term conditions are likely to be limiting. They are less likely to engage with disease prevention, like cancer screening and immunization. And people with low health literacy skills or levels have a low response to public healthy living campaigns. And why is that then a problem for staff? Well, low health literacy, as it says on your screen, can affect staff morale and job satisfaction, and of course, quality and safety of care. Now, Australia is one of the few countries who have adopted a national approach to health literacy, and they treat health literacy as a quality and safety issue. In their 2014 Quality and Safety Report, it highlights the links between health literacy and the quality and safety of care within health organisations. Low individual health literacy is associated with higher rates of hospitalisation and emergency care, and with higher rates of outcomes generally, which is why they have included it in their Quality and Safety Commission. If someone doesn't understand a consent form, then are they really giving informed consent? And of course, is that safe? And if someone doesn't fully understand their care, they can't fully express their wishes or preferences. And this leads to lower quality of care and, of course, less personalised care. And so what about organisations? What effect does this have on organisations? Well, apart from the quality and safety issue and the pressure on systems and services not being used correctly, it's costly. It costs a lot of money. And a study was done a few years ago to identify those costs and found that it costs between 3 to 5% of the national NHS budget. And based on the 2021 budget, to put that into monetary terms, that was £5.3 billion to £8.8 billion. So I'm sure you'll agree that that is just huge. And so what does it look like? Well, it's been health literacy levels or low health literacy levels have been linked to DNAs, incorrect medicine use, as we've said, pressure on A&E or pressure on services in general because people can't do the preventative care that's required. And people might say that they have bigger problems to deal with more than just changing the words on a page. But people struggling to understand information has an impact on those bigger problems like waiting lists and attendance. And so, of course, if appointment letters aren't clear, then naturally people are going to struggle to make it to an appointment at the right time or indeed go to the right place. And if medication instructions are complex, then of course, people may feel that it's safer not to take them rather than get it wrong. And so this all sounds very daunting and it is a huge problem, but there are things that we can do today to address these issues. And one way is treating health literacy as a universal precaution. It's not about creating easy read versions of a leaflet. It's about changing the default and making sure that everyone has equal access, making sure that there's that fair access to health information right across the system and our region. When people come into a hospital, we don't actually know whether they're carrying germs or not, but we do make the assumption that they are. And to try and stop this from spreading, we do things like regular hand washing, wearing gloves and face masks, because it's cheaper to pay for the gloves and the face masks and the soap rather than dealing with an outbreak. So we need to be thinking of health literacy in this same way. It is invisible. You can't tell what someone's health literacy level is by looking at them. And of course, if you knew that every other person coming in to the hospital had an infectious disease, then you would treat everyone as though they did. And so we're encouraging people to think of health literacy in this manner and to explain things simply in everyday language and making sure, as I've just said, that everything is easily understood and easily accessible for everyone. When it comes back to looking back to those ways that health information is shared, there's lots of different techniques and tips and resources to help with sharing the information. Thinking about speaking, you might have heard of the chunk and check or teach back, and it's about breaking information down into really small, manageable chunks and discussing those chunks one at a time, because that'll give you a better gauge of whether something has been misunderstood. And with the teach back, it might be, can you repeat back what I've just said in your own words? Or sometimes it's called me a show me. So it might be, can you show me how you're going to use your inhaler? When it comes to writing, it's about putting things, as I said, into plain, easy to read, lovely, simple, everyday language. Digital skills, there is something called Learn My Way, which ironically is a website, but it's something that we recommend and signpost people to. And it's a really good resource for people to upskill their IT skills. So it might be little modules about internet safety or banking, or there is something that takes you through using the NHS app. And when it comes to the environment or signs and directions, better maps, better signs or directions, just make sure that everyone has equal access, and renaming clinics so that all of the information given to a service user or a patient is consistent. In our full health literacy awareness training and how to write simply training, we go into lots of these skills and techniques and resources in much more detail. And involving local communities in the production of information obviously supports the ethos of personalised care and engages the population in their own health and well-being. So seeking opinions and advice from the general public reinforces the messages. And our regional team have already done lots of community engagement. And so I've got some examples for you. We took some of the leaflets out to the general public before the regional health literacy editors got their hands on them, so to speak. And this was the feedback that we got. They said that the information that they had read, or indeed were trying to read, was daunting, panic, scary. And that big block of text in the middle would stop me coming back, which is a real worry, isn't it? If it's a leaflet that's encouraging someone to take action or refer themselves back to a service, that's obviously not going to happen in this case. And now thinking back to that statistic that the average reading age in England of an adult is 9 to 11 years old, that's what our editors bear in mind when they're rewriting, excuse me, health information. And so those same leaflets, our editors rewrote and we took them back out to members of the public, and this was the feedback. They said it was more human. People felt that they were reading something that was actually relevant to them, which was great feedback. This is a genuine quote. You'd get less Raji patients if you gave them this. And that is kind of proof that we went out to our regional general public, that lovely word Raji. But of course, it's great feedback from somebody in our local population about the information that is not just for them, but for everybody, making it easier, accessible, and just able to understand. And this is a great one here. Speaking more normally means I'm more likely to ask questions. And of course, engaging people in their own care is naturally the key to maintaining good, healthy lifestyles and healthy decisions. So as I said, there is some more training available, which is much more in depth. This is a bit of a whistle-stop tour. And I will put the next 2 sessions are next week. So I will put those links in the chat right now. So anybody who's interested can register to sign up to them. And we also have a regional website, which again, I'll put in the chat. So you can have a look at some of the other work that's going on within the region, not just the training available, but it'll give you future dates for the training available as well. So I'll pop that in the chat there. And one more thing in the chat is the regional email address. So that's there if you'd like to contact us about anything else in the future, or indeed just pick our brains or get in touch. So that's it from me, really. Does anyone have any questions?
Brilliant. Thank you so much, Tracey. That was really informative and mad to think of, you know, how much health literacy kind of gets involved with. Do you know what I mean? You know, you don't even think about, you know, the safety side of things as well, but of course that's a major factor in it all if we don't bear that in mind as well. So yeah, no, thank you for that. So I think we've got somebody with their hand up in the chat. We've got Violet. Violet, would you like to come off mute?
Yes. It's very interesting, Esther. I'm very much concerned about health literacy. But the thing is, it's not. I think it's not just about the fact whether people can understand the words, but also the fact that health literacy is about individuals are not really very clear on what basic care and basic health aspects are. And I think that's a very vital part. It seems to people seem to have lost the capacity to understand just basic health care, and then which is very important for all family members, I think. And yes, sort of the aspect of being able to read and not not have sort of very technical words is vital, but it's also about health literacy is about understanding. Someone's got some kind of condition, understanding the basics of care in that situation. Sorry, I'm very passionate about this, and really, I see it all the time. Sorry,
it's quite all right, Violet. Please don't apologise for your passion. And you're absolutely right. It is about the basic steps to looking after yourself. And in our full sessions, the awareness session, but particularly the How to Write Simply session, we adamantly encourage everybody, where possible, not to use medical terminology, jargon, or acronyms. The NHS is full of acronyms and not everybody knows what they mean, you know. But with regards to the medical terminology, we always ask that people write the explanation, the very simple explanation first, and then put the medical term in brackets afterwards, so that people can skip over that if they don't understand it or can't read it. There is an NHS guide to writing. I think it's called the A to Z guide to writing, which is available online, that we always signpost people to. And when it comes to acronyms, they ask people not to use any acronyms apart from NHS, which one would assume that most people know. But apart from that, again, it's about putting those words, those terms into much simpler everyday language first, and then perhaps the acronym and brackets if need be. And of course, as I said, it's not just about written information in leaflets, it's about accessing the health system or the information or advice that you need in the first place. You're absolutely right, Violet. Yeah. One of the work streams that we're involved with across the region is shadowing a pathway, and that includes ourselves, our team, going out and taking that patient journey, shall we say. So we look at right from the beginning, is the car park easy to find at the destination? Is the signage right to find the appointments, department, or is the self-check-in easy to work? So we go right through that patient journey, as well as, of course, all the information that's given out to the patient too, and then strip it back, put it into everyday language, and then do the training for the teams involved as well, and speak to the patients and service users as well. It's an ongoing project. We're a relatively new team, but all of the work that we're doing out there is just reaping great rewards for some of the teams that have been involved. Do we have something else?
It is a good idea. I think all information is valuable in relation to how it helps a patient in whatever way it can, because it's sometimes I think sort of the patient is considered, or it's too technical for them to know about, but it's not really. If they're given straightforward, genuine, clear information, that can be a very great help psychologically. And you've got to think of the patient in a holistic way, and that's the way to help them most of the time. Anyway, thank you.
Absolutely, yeah, you're absolutely right, Violet. Yeah. We are in our Speaking Simply sessions, we always encourage people to imagine that they're talking to their friend, not somebody who they work with, not somebody who has medical experience or background. Imagine you're talking to your friend. How would you explain it to a friend?
Brilliant, Tracey. We've got somebody else who's got their hand up. We've got Jacob. Have you got a question for us, Jacob? I think he might have posted something.
Hello.
Oh, hi there, Jacob. Hello.
Hi, Jacob. I'm not Jacob.
Okay.
Jacob's kind of my son-in-law. I do apologise.
That's okay.
I thought I might come across as who I am. My name's Hugh Van Hoff. I'm a GP. I live in Gloucestershire, and I've been running a health literacy programme here in Gloucestershire for 15 years now. We work in primary schools, and we are due to start a project with Jill Rowlands in Newcastle in the next 24 months, working in the early years settings. We've got a lot of evidence that the programme we deliver to children here in Gloucestershire, where we've reached 90% of the children, is helping them change their attitudes towards illness and helping them take better responsibility. So we're trying to help them take ownership for their own health without cluttering the conversation with technical language. So we're working, everything you talked about, Tracey, is extremely important, and this isn't in contrast or it complements what you're doing, but we're working in schools to help children talk about illness and for it to become part of their normal dialogue.
That sounds excellent work. I'm glad you've hooked up with Jill as well. She's brilliant and she's so passionate. But yeah, that sounds brilliant because, of course, like you say, tackling things when people are young enough to start to have those conversations and make that understanding is wonderful. My background is in education. I was a librarian in schools for a long time. So I'm really rooting for you. That sounds like wonderful work. And part of the regional team that I work for now, we don't just work with NHS organisations, we're working with local authorities and voluntary sectors as well. So it really is, like you say, about spreading the words right across the region and across all sort of access points as well. That's brilliant.
Thank you.
Thanks.
Brilliant. Well, thank you everyone so much for attending, and thank you to Tracey for coming along and talking about this really important work. Again, just a reminder, there is a link to be able to give feedback in the chat. We do have a number of Lunch and Learn sessions coming up, and we'll put the details of those in the chat as well. The next one's going to be on the 29th of July at 1 o'clock, where we're going to be joined by Zoe Pierce and Marie Gray from Barnsley Hospital, and they're going to be talking to us about improving the patient journey and experience from admission to discharge using process improvement. So we hope that you're able to make that one. Once again, thank you so much, Tracey, and I hope everyone enjoys the rest of their afternoon. Thank you.
Thanks very much, everyone.
Thank you.
Thanks very much. Cheers.